the total soccer amount is.
Thank you, John. Coy, does that help?
That really does, and I'm very pleased to hear that. That most of them did let us keep the money, and that shows that they have trust and know that we're using the money as we should, and they love, I think, what we have and use the money for the scholarships as well as the nonprofit organizations and any other contributions that we give. So that's very good of the community to let us do that.
I agree.
Yeah,
I
and
think we're blessed.
I know that one person who did have the money back was a restaurant, and under the circumstances, you can kind of understand that. I don't think that's a reflection on us. That's a reflection on the present situation.
Agreed. All right. Well, any other announcements or questions or questions about the club or anything else before we go to David Haas? David, all yours.
Dave, you can go ahead and unmute yourself.
Okay. How's that?
Good.
I can hear you.
Okay, I'm sorry. Good afternoon to everybody. On May 11th, I've got the paper right here, May 11th, Hickory Daily Record. There was a nice article. Some of you probably saw it. Nursing instructor joins COVID fight in New York. And that was right after, we had Gerald's program, which was moving, I guess is the way to say it. It was really, really what a story. So I read this article. It was really good. And I know the president at CCC and TI, Mark Porch. I thought, I'll just call Mark and get her to speak. I didn't even have to do that. This lady is so nice. I just wrote her an email and she responded the very next day and said she'd be glad to do a program. And we're lucky to have her. Let me take a second to tell you about her. Her name is Karen Starnes-Bale. Karen, I noticed your maiden name is Starnes. Are you a Granite Falls Starnes?
I sure am.
Well, I bet I know a lot of your family.
I'll claim most of them.
A lot of Starnes in Granite Falls. She's a respiratory therapist for 26 years, a registered nurse for 18, married for 23 years, and has 2 boys, ages 11 and 13. She has worked at 2 local hospitals for a total of 23 years. The last 3 she has taught at CCC and TI full-time as a nursing instructor. Her specialties are ICU, neonatal ICU, ED, and med-surg. Bill, Larry, you can tell me what the ED and med-surg are.
Med-surg is short for medical, surgical, and ED is emergency department, I suspect.
Okay. And she obtained her master's in nursing in 2017 and is currently working on her doctorate at Liberty. And she is a published author, so wow, what a resume. And Karen, thank you. The floor is yours. Please tell us your story, and then we'll have some questions for you after.
Okay, well, I'll go ahead and tell you guys I am a local from Caldwell County. You can tell by my accent. Born and raised on a farm. Always loved to help people, save animals, wanted to be a vet, but then I decided I couldn't put animals to sleep. So I became a nurse. So I became a respiratory therapist. And can you guys still hear me? Because it's saying my internet's unstable. Can everybody hear me?
I can hear you. Your picture is not catching up with your words.
Oh, I'm sorry. I don't know how to fix that. My internet here is terrible, but so long story short, I became a respiratory therapist. I was 19 years old, worked for many years as a therapist. I loved neonatal ICU, but as a therapist, you were always, you were either on med-surg, you were in the ICU, you were in the ER. I wanted to be specifically in the neonatal ICU, so I became a nurse and worked in neuro ICU for a year until a position became available in the ICU, neonatal ICU. They hired me, loved it, stayed there, was on the transport team, always had students and was always, the educator, and they always sent new grads and everybody to me because I guess I guess I was good at that. So I decided later on that, maybe I'll do some clinicals for students. So, I was an adjunct instructor for Caldwell Community College and Western Piedmont, and had students in different clinical sites, and then decided I liked it, got my master's in education, nursing education, and that's where it led me to Caldwell Community College. So with that being said, when 9/11 happened, I wanted to go help. It's like every time a disaster happens, something inside me says, you gotta go help. And I never have been able to go. It just hasn't worked out. And when COVID happened, I talked to my boss, talked to my family, and it kind of worked out that I got to go. Not pushing my religion on anybody, but I get teary talking a lot because I still have a lot of emotion from what I experienced up there. Anyway, I talked to my boss, and she said, if it'll work out, I don't see why you can't go. Well, I kept calling this number and never could get through, and they had a Facebook group called 136 times. Doesn't look like I'm going to be going. Good luck to those of you that get accepted. So I sat down on the couch, and I was kind of bummed, but then I was kind of relieved too, because I said, at least I know I tried. Well, within 5 minutes, and I'm not exaggerating, within 5 minutes, I laid my head back on the couch and I said, God, I know you want me to be there. And if you do, send me. And within 5 minutes, my phone rang, and it was a recruiter, and she had saw my post on Facebook. So that was on Friday evening at 6 o'clock, and April the 5th on Sunday morning, I was headed to New York City. I prepped to go, a lot of community support, people donating scrubs, because I have a million pair of scrubs and I only had one pair of navy blue, and they required navy blue. So people heard the story, donated scrubs. Anyway, the community support was phenomenal. I was very excited, but I was scared because I have 2 little kids at home. Well, they're not little anymore, but 11 and 13. I hated to leave them. I had to at least sign on for a month leave. All of the stories on the news and everything. I was like, okay, is it bad? Is it, are they blowing it out of proportion? So I arrived, and I'll just say it was bad. Thank God it's not as bad down here as it was up there. But we had to go every day. We had to go to a meeting in the morning at 5 o'clock, and they would tell us if we were going to be going to our hospital that day or not. So for the first 2 days, they didn't have an assignment for me because they had to get all the paperwork and everything in order. And the third day, I go at 5 a.m. and they said, you're going to work tonight at a hospital in Queens. And I think I can tell you the name of the hospital. It was Elmhurst. And so I was like, okay, I really didn't want nights. I didn't tell them that, but I didn't want night shift. But, I was there to do what I was there to do. And I thought, well, either way, I'll be working 12 hours and sleeping either way. So it was kind of rinse, dry, repeat. So I went back up to my room, got me a little bite to eat, took me a nap, and prepared to go that evening. So we had to go down and get on our buses at 5:45. They took us to the hospital, and from there this is really the first time I've talked about it, other than when Dave Faraday came and interviewed me. So if I get teary, I'm sorry. I walked in, and I was like, oh, Lord, what have I done? I walked in, and, I'm a respiratory therapist and a nurse. I'm used to ICU patients, but they took us to a unit. It was 36 beds, 36 vents. All of them were dying. It was basically a hospice unit. So we all go in there, and at first I was like, I was very shocked and thought, I don't know how I'm going to do this. But I know it was prayers from back home. I was like, okay, I'm going to do, it's what I have to do. So I started working, and within about 2 hours, our team leader came up to me and she said, we're moving you guys to another unit. So I kind of was like, yay, you know, maybe it'll be a little better. But it wasn't. It was just a PACU that they had converted into an intensive care unit. Same thing, but it was only 12 beds, but all 12 were vents, and all 12 were dying. They were so sick. So I go down there and I work, and then the next morning, we all get on the bus, and there was only 8 of us from our hotel that went to this particular hospital. So we're on the bus, and it's complete silence all the way home, because all of us were in one of those 2 units, and it was such a eye-opening experience. We had a 25-minute drive on the way home, and nobody said a word. We were just that taken aback. So I'm also in school getting my doctorate at Liberty, so I was having to go home, try to stay awake, do homework, and go to bed, get back on what I was going to do about food. So that was our first night. Every night from then on out was basically the same. They would either transfer me to that unit that I started out on, the 36 beds, or the 12 beds. My first night, my patient passed away, my very first night. So I was like, great, this is going to be, you know, an experience that's going to give me PTSD. So anyway, I'm getting it together. Hang tight. So I was struggling mentally, physically. I was exhausted. I did 20 nights in a row, 12-hour shifts. Never sat down. Hardly ever got to go to the bathroom because we had to garb up and put, you know, I had a mask on, a surgical mask over that. You had to wear hair covers, eye shields. I had a gown on backwards, a gown on frontwards. I had shoe covers on. So by the time you get in the unit, if you had to go to the bathroom, it was just like, you know, it was an act of Congress to have to take all that off, go out, wash up, go to the bathroom, and then come back and put it all in, or put it all on. So I decided to help myself. It made me feel good to talk about it. So I had never done Facebook Live videos or anything. I didn't even know what I was doing. And if you ever watched any of the live videos I made them public, you can tell I didn't know what I was doing, because sometimes, you know, the camera would be on my forehead, or, you know, I'd have the camera turned the wrong way or something. But I had so much support from those videos. I honestly think that's what got me through the 21 days that I was up there. One video had over 11,000 views, and I mean, I didn't even know I knew that many people. So that really, I think, helped me kind of verbalize some of my emotions and get me through. And these were 18-hour days. You know, basically by the time we got on the bus, worked our 12 hours, gave report, got back on the bus, got home. I mean, it ended up being 16 to 18-hour days. So I know one morning I went to talk to Human Resources to get some paperwork straightened out, and I just lost it. I just started crying, and they were like, "Are you okay?" I said, "I'm just so tired." So I know they thought, "Lord, she needs a psych eval," but I was fine after I got sleep. So I will tell you, I took care of this one patient. They were kidney failure from the D-dimers being so high. Some were having heart failure. This guy was 36 and had a lot of no comorbidities, but had a lot of issues from the COVID. So I had him for 5 nights in a row, took care of him, did everything I could, and finally, some positivity. He actually was extubated, taken off the ventilator. and was doing well. He was unable to speak English. I'm unable to speak Spanish. So there was a bit of a, plus with my accent, there was a lot of issues there. So a friend of mine, Jennifer, that I had met there, she was able to translate for me. And I looked on the computer and got a phone number, used a friend's phone. We called and did a chat, a live chat with his family. And so they couldn't call, they couldn't visit. They didn't even know if these patients their family was alive or dead. So when we called, that moment made it worth me being there through all I went through, because even in Spanish language, any language, sadness, happiness, fear, it all translates the same. So whenever we made the FaceTime call, it was to the young man's aunt and their family. I guess I'm assuming he lived with them. And just to see their happiness, their tears of happiness, and his tears of happiness of recovery made it all worthwhile. So that's kind of a little bit of my story there. I hate to sound like a Debbie Downer, but it just was it was a rough experience. It's changed me in many ways. We're so unprepared for these kinds of scenarios, and I'm not blaming anybody, but we didn't even have beds for these patients. So we had one lady on a stretcher for 3 weeks. We didn't even have a proper bed to put her in. Her husband passed away of COVID, and she died the day that he was buried. So that was rough to know. And the thing that bothered me the most was she couldn't even die on a comfortable bed. She had to die on a stretcher with bed sores because we didn't have enough manpower to turn these patients as we needed to. And I just have to realize, and you would think after almost 30 years, I would know that we can't save everybody, but that one really hit home with me. I just kept imagining, my family there. Nobody at the bedside. She didn't even know that her husband had passed away, and then she passed away. And then to think about her kids having to bury their mother and their father. And this happened more than once. I have more stories like that than I can tell you. We had an ICU nurse pass away. We had this disease did not discriminate age. We lost 40-year-olds. We lost 54-year-olds. We lost 80-year-olds. It was all over the spectrum. I'm sure there was some pediatric patients too, but I wasn't in that unit. I don't know. That's I probably was all over the place and have you guys all wondering what in the world's going on in my head, but that's pretty much my story. It was a daily occurrence, same story, maybe a different patient, same hospital, same bus ride, just, a lot of death. So then when I came back home and, a lot of people saying that COVID's not real and all this, not to compare myself to Vietnam vets at all, but I kind of understand how they felt, when they came home and were spit on and, basically saying they shouldn't have done what they did. Because when I come home and people were saying, COVID's not real and it's just made up and all this, that really hurts. And I hate that people think the way they think, but I can't change that. All I know is what I saw and what I experienced. And I was so happy to get on that plane to come home. Would I do it again? I think I would, just not right now. Would I encourage everybody to try and do that? No. I have friends. I made a group of friends while I was there. We all rode the bus together, and we all are lifelong friends now, all from different states of the country. And I do have a friend that's probably going to have to go to therapy from some of the stuff we experienced. She's not dealing well with it. She's having nightmares. You know, I feel like there is some PTSD there. But thank God, I mean, I just cry when I talk about it, and I think I'll get over that eventually. It just hurts to know that the people were dying alone. So I don't know how long I've gabbed for, or how much time y'all have. But if y'all have any questions, I welcome them. And I'm sure I will think about, I had some little notes written down. I'm sure I'll think about some things to tell you guys as questions arise.
And thank you, Karen. And if you can see the chat, I don't know, that's sometimes the easiest way to do it. If folks can just type some things in the chat box. If not, I mean, you know, obviously everybody can, you know, unmute themselves and whatnot and ask as well.
Oh yeah, Catherine Newton. So we have a friend that is, her son is friends with my son. So it's a small world.
No, thank you so much for what you shared with us, and I know that was tough for you. I immediately knew you must know Gina Fox, my assistant, who's been with me for many, many years, and she's just such a fine person. And I can see where the two of you would hit it off well. Thank you so much for what you did. Really impressive story.
Oh, well, everybody is welcome. That's one thing I did. I didn't do it for fame or anything. I did it because my heart told me that's what I needed to do. And so it's kind of weird whenever, you know, like Dave Faraday wanted to interview me. I was like, I don't want that. You know, I don't want it to be about me. I want to get the story out there to where people know, you know, what is out there. So I hope you guys don't think, even when David reached out to me, I was kind of leery because I was like, effect to where everybody's contacting me wanting to interview me unless it's just about COVID itself and my story. So I hope you guys know that it's just about my experience and what's going on in our world. Do I have any idea why it spread to many people in that area? I have a couple thoughts on that, William. I feel like, you know, the population is so dense there. There's so many people. There are, you know, I have some theories. Most of the patients I took care of, 99% of them were Hispanic. And, you know, they live in close quarters. Most of them live in Queens. So I don't know if it's the close proximity of the families. I don't know if for some reason this disease strikes Hispanics differently because of, you know, their genetic makeup, or, you know, I don't know. I wish I did know. I feel like it's more about the population up there there's so many people. I also do feel like there's a lot of strains of this COVID around. I can't wait, and this will tell you what a nerd I am. I can't wait to find out about the different strains and what they affect, and, you know, why it's not as bad here as it is there on the people. So I hope that answers your questions. Monica, how did your question didn't come through? How do we get to the videos you did? If you're on Facebook, you can look me up, Karen Starnes Bell, and they are made public where you can see the videos. You just scroll all the way down, though, to see the first one, and then you can see the progression all the way up to the top.
Are you seeing that the impact on the virus on people in this area if they catch it, is still less of an impact?
I'm not going to say less of an impact. I just think our numbers as far as population are so much smaller here.
Sure, right.
You know, I feel like it's probably the same. And I've talked to a couple of my respiratory therapy friends, and the ones that they've had in Hickory that are doing bad are also Hispanics. So that's why I feel like there's something there. But I mean, I may be totally going down a rabbit hole that doesn't exist, but I just feel like that there's something to do with that.
Right. Okay.
The one person that we've had speak and tell us his story said I believe said his blood type was type A. Do you think that has anything to do with it?
That was a good theory. I had that in my mind when I went to New York. So as I took care of patients, I looked at other patients' blood types that they had typed and crossed, and they were all over the spectrum. We had O positive, O negative, A positive. I never saw any A negatives, but I think that kind of ruled that out from that perspective. Now, scientifically, they may come up with something saying differently, but based on the patients I cared for, I didn't see that made a difference.
How many
nurses
did they have per patient?
At first, that we were having 5 patients to 1 nurse,
Okay.
which was you can't be a good nurse like that. But the whole time, most of the time I was there, it was 2 to 1, which was still kind of rough because they were so sick, but that was manageable.
Mm-hmm.
I'm just glad I wasn't on the first wave that got sent, because they're the ones that really, I think, got slammed with the 5 to 1.
Right.
Let's see.
Karen?
How did the residents of New York City respond? Yes.
Oh, Karen, this is Julie Packer. Can you hear me?
Yes, I can.
Thank you so much for your true, real altruism. I mean, willingness to leave your family and your community and travel far to, the front line. I watched a lot of your FaceTime videos and may have made some comments to you. You didn't know me, but I work for hospice here in the area, and I'm worried about your grief. So what are you doing for yourself now? You sound very healthy in that you're expressive, which is good. But I mean, this is cumulative grief. It's just unprecedented. And it's disenfranchised grief for these poor people who died, who, like you said, were without their family, and you became that for them. Yeah. I thank you for that. But that's a burden you're carrying. So how are you taking care of yourself?
That's a good question. I've felt like I've actually been doing pretty well, but when I talk about it, that's when all my emotion comes out. So I don't know, maybe I need to have a little therapy. And I've considered that, and I've talked colleges, and she's recommended a few people that maybe I could just go and speak with. I feel like talking about it is going to be my outlet, though.
Good.
And I'm journaling, so I hope to possibly write a book about it one day. But it's strange right now. People will ask me, they're like, "Oh, you got to tell me all about it." I'm like, I don't want to talk about it. I just really don't want to talk about it. And then, my husband will be like, "Well, what did you experience doing this and this and this?" And I'm like, I just really don't want to talk about it. It's weird. I just don't want to talk about it. So if you have any suggestions, I'm open.
Well, there's lots of help in the area, and you seem to be really healthy in your attitude and aware of yourself. So keep on with that. And when times are tough, seek someone to talk to.
Yeah, I definitely will, because I don't want, I don't want those 21 days to ruin my life or my kids or my husband's life just because I'm grieving, in a bad way. So I just have a big heart, and I always have had a big heart, and my heart just still hurts so bad for those people.
We can feel it. We can see it. It's real. You're very real.
There's nothing fake about me. I can't even fake my accent. I tried.
Karen, I wanted to send you something. There was an article just yesterday in the Wall Street Journal written by a man who had written and journaled over the years, precipitated by emotions that he had experienced, traumatic things. I'd like to send you that article.
That'd be great.
I think it might really help you, and I would love to support you in your quest to write something about this for all of us to read. So just give me your email address, and I'd like to send you that article.
Okay, I definitely will. I'll put it on these comments too. There's a couple questions here. How did the residents of New York City respond there? They actually did very well. I mean, the whole city was shut down, and I know most of you have probably been there, and it's, you know, shoulder to shoulder. And if you'll look on my Facebook page and in the article that was in the Hickory Daily Record, I have a picture of Times Square and it's empty. So they listened, they stayed in when they were supposed to. They were so supportive of us. You know, they'd have little parades as we were going to work, you know, and we had these people that would walk by our bus with signs every day that said, "We love you, thank you," and then they tried to throw some humor in there, and the guy flipped the sign around and it said, "And you're sexy," to all the nurses. So it made us all giggle going to work, you know, which we needed. So they all were very kind. Some of the nurses, though, I will say, they were not as accepting to us because honestly, I feel like we knew more, like the travel nurses knew more than they did. And they took it at first, they had to get to trust you. And, you know, they would come walking around and be like, "Have you changed this and this and this?" And I think that's the only thing they knew to do that was right. So finally, we would get it to where, you know, we'd say, "Look, we know what we're doing. Let us do our thing. You go back here and relax because we're only here for 21 days. If you need to learn something, come to us and we'll show you." But most of the nurses that were in charge had no ICU experience. So it was kind of scary. But a lot of them were sick too with COVID. So they were out. So it was just, there was more travel nurses than staff nurses there. So, okay. Let's see. Did any therapeutic change during your time there allow more success getting patients off vents? No, it was getting those patients weaned it worked. We, you know, we would do high respiratory rates and low tidal volumes for those of you that are in the medical field. We'd have them breathing 32 times a minute and a tidal volume of like 240. That was doing a little bit of work, but it still wasn't getting their ABGs where we needed them to be. So I know some of you probably read articles and seen where we do the prone positioning. Yeah. So we'd flip them on their stomachs, and they had a very nice policy that a guy flew in from Oregon that was an expert at this, and he formed a team with parajumpers, and they came around and did their thing, and they'd flip the patients, and that was a chore. Because, you know, I worked in the neonatal ICU with little 2 pounds. You flip them pretty easy, but you have a 200-pound man laying there with all these tubes and wires. They actually had it down to a science where they wrapped them up like a burrito and flipped them. They had somebody managing the airway and all that, and that worked miracles. I mean, their oxygenation went. So they had the protocol where we'd leave them on their stomach for 16 hours and then flip. Of course, we'd have to be turning them a little bit, and then we'd flip them on their back for 8. And then that honestly was the only thing that I saw making a tiny change. So let's see. Why was the Jarvis Center and the USSNS Comfort not utilized very much? That is a good question. I asked the same thing because, you know, here we were busting at the seams, you know, at Elmhurst, and then supposedly the ship had 2 to 4 patients. So I don't know the answer to that. I'd love to find it out, though. Did any of the travel nurses get sick? The ones in my group are all negative. we're all still talking. There's one girl still up there working. She's been there for 2 months now, and she's still going strong. Still negative, and all is good. So I think that's all the questions. Did I miss any? They did have parades for us. The fire department came out and at each hospital, and they'd have, you know, their trucks all line the streets, and then they'd have the American flag that said thank you to all of our healthcare workers. And, you know, that really, it meant a lot, how accepting the city was to us. So.
Karen, my daughter lives in Brooklyn. Are these patients concentrated primarily in a certain borough more than others, or are they spreading them out? Are they spreading the wealth of the patients among the hospitals in the 5 boroughs, or how's that working? Was Queens a concentrated area, or, I mean, it sounds like it was by what you described in terms of numbers of beds. Was it like that in every hospital in the area in New York?
I feel like it was. So we were at the Marriott in Times Square, and it was full of nurses. And there was probably 40 buses going to 40 different locations every day. So I think that those 40-ish hospitals were the ones where they made the COVID hospitals. Now, I do know that they had some hospitals that were supposedly for the not as sick patients. So the guy that was extubated and was able to talk to his family, I know that they sent him out to Roosevelt the next morning because they said that was where the more healthy ones were going. So I don't know, you know, per se what each one did, but they did have designated COVID facilities, but there were a lot of them. So.
Interesting.
Oh, I'm just reading. Let's see. Yes, I quarantined myself when I came home. I actually, I just bought a condo down at the beach 2 years ago. So just so I wouldn't be tempted to go hug my kids because I missed them so bad. My husband suggested, he was like, I feel like you just need to go there because you know you're not going to be able to stay from them. So I came to the condo, and for 2 weeks I was cooped up in here, and actually, but I was so exhausted, I'd get up and shower and go right back to bed.
Well, Karen, I'm an old retired nurse.
Did I answer everybody's? Are
Karen,
you?
Karen, I don't know if you can hear me, but I started out as an old retired nurse, and I too want to commend you for your selfless act, having a family and a marriage, and being willing to travel and expose yourself to those conditions. It's why we do what we do, and I thank you for that.
Right. Well, thank you. I appreciate those words. I look back now, and my mom, when I told her, I mean, I'm 45 years old. My mom still treats me like a child, and she basically was begging me not to go and had me in the grave, you know. And I look back now, and I'm thinking, you know, I could have not returned home, but I didn't even think about that. I just did what I was told to do, and thank God I'm home.
Well, it's the Rotary way. It's called service above self.
Yeah. I've never put myself first. So I think that's just how I was made and made to be a nurse.
I'm glad you made that career decision. It was a good one. Good luck with your doctorate, by the way.
Well, thank you. It's killing me, but it's going to kill me before COVID does.
David, thank you for arranging this program. That it has occupied our thoughts now for almost a month, but it's also, like Julie said, these are unprecedented times, and hopefully all of us will live through this and be able to look back on this life-changing event of 2020. It's not over. It's I'm afraid it's far from over, but I am glad you have returned safe and gone through the quarantine and are healthy. And I would echo Julie's sentiment that you might want to sit down, talk to somebody, and decompress some. But I do thank you.
Thank you. Thank you guys very much for having me, and I appreciate all you do for the community, and maybe we could work together and help support the community together someday.
Karen, I was administration at Catawba Valley Community College for 27 years before I retired.
You look familiar to me.
And so I'm Coy Hudson. My name's Coy Hudson. And
Boy, I know you.
You know me.
I do.
How do you know me?
When I went to respiratory therapy school there back in '94, you were there.
Yes, I was. I was Dean of Instruction. I was. So I just wanted to thank you. I want to thank you so much for your service in the Caldwell Community College. I know Mark Porch. He was at CVCC for a number of years. He's a good friend of mine, and I just have a lot of respect. I have a lot of respect for him, the college there, and certainly for you. And thank you so much for your service, not only what you had done in New York, but all the years you provided in your service to the healthcare field, and it's very much appreciated.
Well, thank you very much. I appreciate it. Thank you guys for having me, and I hope I didn't. I see a lot of squirrels. That's what all my friends say. I dart from here to there and everywhere. So I hope I didn't make you guys feel schizophrenic or anything while you were listening to me.
Karen, enjoy your time at the beach with your family.
Thank you very much. And if you guys would ever, I heard you guys talking about scholarships. I would love for one of our nursing students, if you ever consider a nursing student possibly, which we'd appreciate that. All right, I guess you guys.
Anybody else have anything for our club before we all sign off?
Bill, I just want to add that we do have a program next week.
Hi, Ingrid.
Kiesler from the chamber is going to be giving us an update on all their response as an organization. So she's going to talk about that, their open and safe plan that they've rolled out for businesses. So I think it'll be a really great opportunity to get an update from Lindsay on the chamber next week. That'll be our program.
Excellent.
Thank you.
Thank you so much for arranging that, Ingrid. And I can't wait. That will be a wonderful program. Her columns, I hope y'all read them in the paper, are absolutely excellent. Anything else for the good of the club? I don't know when we're going to get back to Lake Hickory Country Club. I know it will be some time, but I look forward to seeing all of you face to face. We'll close with the 4-way test of the things we think, say, or do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? I hope y'all stay safe. See you next Tuesday.
Bye.
Everyone, thank you.
Thank you.
Thanks, everybody.
Wonderful, wonderful program.
Take care, everybody.